In late 2009, several stakeholding groups were asked to rate the 167 draft Healthy People 2020 objectives that were considered relevant to adolescent and young adult health for priority as core. We received 351 responses, which were analyzed electronically. Both the rating and the selection criteria were viewed as having substantive importance. The proportion of young people affected, so that if a problem affected a larger proportion of young people, that would be considered more compelling than one that affected a very small number of young people. And that each objective had to have sufficient specificity to allow a focused action to take place. A volunteer work team from the Adolescent Health Workgroup started work in January 2011 as soon as the Healthy People 2020 objectives were finalized. Next slide, please. So in summary, we selected 41 draft core indicators from across all of Healthy People 2020. They include 26 outcome and 15 systems indicators. And remember that outcome indicators represent health status and behaviors reflecting populations composed of individuals. In contrast, systems indicators are largely under the control of governments, institutions, and organizations through their policies and practices. So if we take a look at the pie graph, that 19 apply just to adolescents, and remember that this is based on actual Healthy People 2020 objectives. 2 apply just to young adults, and 20 converge on being able to include both adolescents and young adults simultaneously. Together, these indicators form 7 areas of focus or domains. And again, the draft core indicators as a document, if you are not able to download them previously, will be emailed to you following the webinar. And once approved, the core indicators will be posted to the Healthy People 2020 website. Next slide, please. So, why have we switched from the term objective to that of indicator? An indicator represents an objective, but is stated without reference to a direction. And really importantly, it can be described in simpler terms compared to an objective, so that it doesn't take quite as long to say it. And the core adolescent and young adult health indicators are similar in function to the leading health indicators of Healthy People 2020. Okay, I'd like to quickly review the 7 domains or areas of focus. The first 3 are healthcare, healthy development, and injury and violence prevention. And the actual indicator topics are included in the parentheses. Next slide, please. The final 4 areas of focus include mental health, substance abuse, sexual health, and the prevention of chronic diseases of adulthood. We are highly cognizant of the need to improve the health status of future cohorts of adults through attention to the health and the health behaviors of adolescents and young adults. For example, if we can prevent tobacco use among adolescents and young adults, we will be able to significantly decrease morbidity and mortality from several key chronic diseases. Next slide, please. I'd like to move a little bit into data considerations. Claire had mentioned some of the difficulties we had during Healthy People 2010. And Healthy People 2020 has tried to strengthen data sources to the best of its ability. To gain full benefit from the Healthy People 2020 website, I'd like you to see how to access important health data elements. Healthy People 2020 contains data templates unique to each measure. Each is easily accessed by clicking View Details and then the link to data from the HHS Health Indicators Warehouse, and we'll visualize these in a moment. The data templates allow comparison across population subgroups in order to identify disparities, and most adolescent health topic area objectives can compare major demographic breakouts within the age group itself. In contrast, the core indicators can be more complex because they're based on the objectives that were developed by other work groups, and so that the major demographic breakouts are not necessarily unique to that age group, but are for the larger group that the objective targets. So, for example, access to health care is targeted to all age groups. This slide shows a screenshot of the first adolescent health topic area objective, Adolescent Wellness Checkup. Is that you can see the expanded details and the link to the HHS Health Indicators Warehouse in the middle of the slide. If you look at the dark blue bars going down, there's 4 of them visible on the screenshot to the right, that this says View Details, and it shows that these other objectives are not expanded the way that the one is for the Adolescent Wellness Checkup. The next slide shows a screenshot of the data template for the same objective. And I know that it's very difficult to read it, but at least you'll be able to see how the data templates are laid out. The right column contains all of the data elements, and so, for example, for this particular objective, it includes such things as gender, race, ethnicity, country of birth, disability status, health insurance status, geographic location, whether the young person lives in a more rural or a more urban location, and family income. The right column provides the actual percentages. Next slide, please. Healthy People 2020 data sources are very unique. However, it's important to recognize that an objective's ability to capture important details is totally dependent on the data source, and some data sources provide more information than others. To maximize the usefulness of Healthy People 2020, it's very important for states to be able to measure as many objectives as possible. And I wanted to talk a little bit about which types of objectives might have data available at the state level. So, for example, objectives that are based on the National Vital Statistics System, and remember the states provide these data, actually have data available on the immediately looking at state rates. So, for example, as it relates to adolescents and young adults, mortality rates from homicide and suicide are available, by states. The Department of Education's Common Core of Data contains a state survey of public education, and we now know what graduation rates are across each state. A few surveillance systems use a state-based sampling frame. So, for example, for states that participate in the youth risk behavioral surveillance system, that those data will be available by states. The National Survey on Children's Health and the National Survey on Children with Special Health Care Needs both use a state-based sampling frame. In contrast, most surveillance systems use a national sampling frame, and for these, that states will not have data unique to them that are available. And so this would include such really important surveillance systems as the National Health Interview Survey, the National Health and Nutrition Examination Survey, the National Survey on Drug Use and Health, the National Survey on Family Growth, and the National Survey on Children Exposed to Violence. Next slide, please. So, what can you expect in the future from the adolescent health component of Healthy People 2020? There's going to be an online Healthy People 2020 set of evidence-based resources for addressing adolescent health topic area objectives, and our work group is currently working on this. There will be a structured PubMed search that if you enter a query for each objective and each sub-objective, that you will then be able to generate a list of articles, peer-reviewed articles, that actually provide a lot of excellent information for each objective and sub-objective within the adolescent health topic area. And what's kind of innovative and unique about this is that the query has been set up so that, say, 5 years down the road, is that you want to take a look at articles that have come about since the year 2011, is that you're still going to be able to generate all of the new articles that are relevant to that objective or sub-objective. We're going to continue to work on the dissemination and diffusion of additional helpful evidence-based resources for states, communities, and organizations. In particular, that we're interested in resources that will help to expand the field of stakeholders for our age groups. We're going to be working on resources that will help us to facilitate engagement with key partners. And finally, and very importantly, a traditional function of Healthy People is to monitor progress